not too detrimental. Stop your fulfill your.
I rather to welcome you to Glow Health Talk with NMA, Nigerian Medical Association, Ondo State Chapter. And of course, this program is co-sponsored by Nigerian Medical Association, Ondo State Chapter. And we do have our producers always in the studio this morning. Dr. Okpeyemi Komolafe is what who ensures that we bring in guests who know their onions every Saturday morning like this. So today, we're looking at a topic, and this concerns you and I. It is on cardiovascular emergencies, the causes, prevention, and what should be our response. That's what we're looking at today. And we have our doctor. He's a consultant cardiologist, Federal Medical Center, or Dr. Tunji Olaoye. Doctor, glad to have you in the studio this morning, sir.
Good morning. Happy to be here.
Yeah, thank you very much. Ètò wa yìí náà ni mixed grill la fi ń ṣe èdè Gẹ̀ẹ́sì àti èdè abínibí wa. A fi ń kí gbogbo àwọn ará ilé pé ẹ káàbọ̀ sórí ètò wa ètò yín ìlera lọ́rọ̀ pẹ̀lú ìbáṣepọ̀ Nigerian Medical Association yẹn ti ìpínlẹ̀ Ondo ń bì. Dókítà tó mọ̀ye wọ́n ti wà ń kalẹ̀ láti fi ọ̀rọ̀ bọ̀ wá dáadáa lórí ohun tá a fẹ́ mẹ́nubà lónìí yẹn kókó tá a fẹ́ mẹ́nubà yẹ cardiovascular emergencies tí máa gbọ́ lédè Yorùbá gan bẹ́ẹ̀ yà máa ti túmọ̀ cardiovascular nǹkan tó ń fà á bá ṣe lè dènà ẹ̀yẹn prevention àti bó ṣe yẹ ká ṣe tó bá ti ṣẹlẹ̀ àwọn gbogbo nǹkan wọ̀nyí náà lọ́wọ́ máa mẹ́nubà lẹ́yọ kankan ní òwúrọ̀ yìí àti dárúkọ wọn lédè Gẹ̀ẹ́sì lẹ́ẹ̀kan àwọn náà ni consultant cardiologist Federal Medical Center ìyẹn tìlú Ọ̀wọ̀ dókítà Tunji Olaoye ẹ káàbọ̀ sórí ètò lẹ́ẹ̀kan sí.
Ẹ ṣé olóòtú. Ẹ káàárọ̀ ẹ̀yin aráalé.
Ara alẹ́ náà ń gbọ́ wa bẹ́ẹ̀ yẹn orúkọ tèmi ni Comfort Ọmọláfẹ́ láì fi àkókò ṣòfò dókítà kí ni wọ́n ń pè ní ẹ̀ka bèrè lédè abínibí wa torí ọ̀pọ̀lọpọ̀ àwọn tó ń gbé wa gan báyìí ìpínlẹ̀ Ondo ń bì í ìpínlẹ̀ Yorùbá náà àwọn èèyàn dẹ̀ ń gbọ́ wọ́n ń gbọ́ èdè Gẹ̀ẹ́sì àti èdè Yorùbá wọ́n jà bèrè lédè abínibí wa ẹ̀yà ara wo ni ọ̀bẹ ká tiẹ̀ bèrè pé kí ló ń jẹ́ cardiovascular emergencies gangan kí ni cardiovascular kó tó di pé a bọ́ sí emergencies mo fẹ́ kẹ́ ṣàlàyé kó tó di pàjáwìrì ẹ ṣàlàyé fáwọn aráalé.
Lẹ́ẹ̀kan sí a kí àwọn aráalé. Nǹkan tí a máa ń pè ní cardiovascular emergencies ní èdè abínibí ní nǹkan tó ní ṣe pẹ̀lú ọkàn àti iṣan tó gbé ẹ̀jẹ̀ kúrò nínú ọkàn pẹ̀lú ẹ̀jẹ̀ fúnra ẹ̀. So mẹ́tẹ̀ẹ̀ta lápapọ̀ la máa ń pè ní cardiovascular system. Ọkàn, iṣan tó gbé ẹ̀jẹ̀ kúrò ní ọkàn àti ẹ̀jẹ̀ mẹ́ta yìí lápapọ̀ la máa ń pè ní cardiovascular. And tá bá dẹ̀ ti ń fi emergency sí ó sọ pé pàjáwìrì nípa ọkàn, pàjáwìrì nípa iṣan tó gbé ẹ̀jẹ̀ kúrò nínú ọkàn àti pàjáwìrì ti ẹ̀jẹ̀ fúnra ẹ̀. So ìkan tó ní ṣe pẹ̀lú pàjáwìrì ní àwọn kan mẹ́tẹ̀ẹ̀ta yìí la máa ń pè ní cardiovascular emergencies.
Ẹ ṣeun gan ni Dókítà Tunji Olaoye. Doctor, I would like to ask, what exactly is cardiovascular emergencies? Would like you to relay this in English for the benefit of those listening at this moment, because we have a diverse audience at this time. Remember, we're live on Facebook at Glow 99.1 FM Akure. You can watch us live on our Facebook page, GLOW, Glow 99.1 FM Akure. You may also listen to us live on our Radio Garden app, or Glow 99.1 FM, or on our website, www.glowfmradio.com. Dr. Tunji Olaoye, let's quickly ask you, what exactly is cardiovascular emergencies? Could you please explain to us in just simple terms?
Cardiovascular emergencies can simply describes as things that medical conditions that require urgent medical care that relate to the heart, blood vessels, and also the blood. Now, there are many conditions that could happen to the heart. There are also many conditions that could happen to the blood vessels, and likewise the blood itself. So when we talk about cardiovascular emergencies, any conditions, we could have, individual could have heart attack, which is one of the cardiovascular emergencies. individual could have an heart failure, which also one of the cardiovascular emergencies. There could be stroke, which is one of the cardiovascular emergencies, and the blood pressure could be so elevated that to the point of damaging vital organs in the body. So all these are cardiovascular emergencies, and they all have their difference and pattern ways of presentation. I think in the course of the program, we'll be taking them individually, but majorly cardiovascular emergencies are emergencies that have to deal with heart, the blood vessels, and as is also related to how they supply the brain, the kidney, and also other vital organs.
Thank you very much, Doctor. I'd love to ask you what constitutes the cardiovascular system, but you've mentioned it. So let's quickly move now to our mother tongue on the risk factors, the common causes of cardiovascular emergencies in our environment. Kini àwọn nǹkan bíi bí ìgbé ayé wa àti àwọn àìsàn ara tí ó lè ṣe okùnfà irú àwọn ìpèníjà pàjáwìrì wọ̀nyí. Mo fẹ́ kẹ́ ẹ yànnàná fún àwọn aráalé.
Ní agbègbè wa yìí oríṣiríṣi nǹkan ló lè fà á, ṣùgbọ́n mẹ́ta ló wà lókè téńté. Àkọ́kọ́ ni ìfúnpá tó ga tí gbogbo wa mọ̀ sí hypertension. Àwọn míì lè sọ pé ẹ̀jẹ̀ ríru, àwọn míì lè sọ pé high blood pressure. Oríṣiríṣi ni àwọn èèyàn wa máa ń pè bí èdè àdúgbò, ṣùgbọ́n àwọn olóyìnbó á sọ pé high blood pressure. Ìyẹn ni àkọ́kọ́ nínú nǹkan tó máa ń fa pàjáwìrì tó ní í ṣe pẹ̀lú ọkàn àti iṣan tó ń gbé ẹ̀jẹ̀ kúrò lára. Ìkejì ni ṣúgà tá a bójútó dáadáa. A máa ń sọ pé diabetes, ìyẹn náà ṣe pàtàkì, and ó lè jẹ́ ipò kejì. Ìkẹta, a tún rí i pé kéèyàn sanra jù lápọ̀jù, a sọ pé obesity ní èdè òyìnbó. Mẹ́ta yìí òun ló wà ní òkè téńté. Yàtọ̀ sáwọn yẹn, ó tún ní oríṣiríṣi àwọn nǹkan tá a tún lè ṣe tó tún lè fa nǹkan báyìí. Ọtí mímu, alcohol, tábà àbí cigarette, òun náà tún lè fà á. Then bí wàhálà tí ò ní ìsinmi àbí téèyàn ò ní ìtọ́jú lórí ẹ̀. They said that stress that we cannot control, òun náà tún ṣe pàtàkì. Then oúnjẹ, kíyọ̀ pọ̀ jù nínú oúnjẹ wa, àbí oúnjẹ kíákíá, àwọn oúnjẹ tá a máa ń jẹ ní àwọn ilé ìtura àti oríṣiríṣi tó wà ní agbègbè wa, kíákíá ó ti ṣe tán. So gbogbo àwọn nǹkan báyìí. Then àì ń ṣe exercise lóòrèkóòrè, òun náà ó tún nípa. Gbogbo àwọn nǹkan yìí ló lè fa pàjáwìrì tó ní í ṣe pẹ̀lú ọkàn àti iṣan tó gbé ẹ̀jẹ̀ kúrò.
Ẹ ṣeun gan ni dókítà wa. Ẹ jẹ́ àbẹ̀rẹ̀ lédè Gẹ̀ẹ́sì. Doctor, I would like you to please tell us the risk factors and common causes of cardiovascular emergencies in our immediate environment.
It's, the major ones that are major causes of cardiovascular emergencies are hypertension. Hypertension is the major driver of cardiovascular emergencies, not beyond even our own environment, all over the world, and responsible for about 50% of cardiovascular emergencies. So, ó jẹ́ nǹkan tó ṣe pàtàkì, tó jẹ́ is the one that is the major one that causes cardiovascular emergencies. Then in addition, we also have diabetes mellitus, and especially the uncontrolled diabetes mellitus. For those that are aware, it's better that the blood sugar is well controlled. And for those that are not aware, for them to also do checks. Then the third one is obesity. So, excess weight, which it could be overweight, it could be obesity. There are ways we grade some of these things. So those are the three major etiological factors. Now we also now have the risk factors for cardiovascular emergencies. Of course, the three major etiological factors are also important risk factors in it. Uncontrolled hypertension. If one have the etiological factor and is not controlled, then of course it's a major risk factor. Diabetes that is also not controlled is a major risk factor. Then we also have a lack of physical exercise. You know, the whole thing is like someone can get to Europe within how many hours now? Likewise, one can get from Akure to Lagos in about an hour. So I think all those things have reduced the way we exercise. Then cigarette smoking or any form of tobacco use. You know, people have devised ways of using tobacco. So all these are also risk factors. Now the recent one is the air pollution. Our environment also matter. Air pollution is also a major driver of cardiovascular diseases that will also, of course, lead to emergency. So also unhealthy diet, you know, fast food, you know, also that lack of fruits and vegetables, you know, these are also part of unhealthy diet. So, and all these things contribute to an individual developing cardiovascular diseases.
All right, thank you very much, Doctor. Thank you for explaining the risk factors, the common causes of cardiovascular emergencies in our environment. I would like to ask you, maybe I should ask you in our mother tongue. Gẹ́gẹ́ bí ìrírí yín, ṣé àwọn ìpèníjà pàjáwìrì wọ̀nyí ń pọ̀ sí ni tàbí wọ́n ń dínkù ní àwùjọ wa? Mo fẹ́ kẹ́ ẹ ṣàlàyé fáwọn aráalé.
Àwọn pàjáwìrì yìí ó ń pọ̀ sí ni, pàápàá ní ilẹ̀ adúláwọ̀. A rí i pé bíi 20 million people ní pàjáwìrì ọkàn àbí iṣan tó ń gbé ẹ̀jẹ̀ máa ń pa ní ọdọọdún. Eléyìí tó dẹ̀ pọ̀ jù nínú 20 million yìí ó wà ní ilẹ̀ adúláwọ̀. Ó dẹ̀ ní í ṣe pẹ̀lú bí a ṣe ń gbé ìgbé ayé wa tó ti ń jọ ti àwọn òkè òkun. Bó tilẹ̀ jẹ́ pé à ń gbé ìgbé ayé wa ní ti àwọn ilẹ̀ òkun yìí, àwọn nǹkan tá a ní agbègbè yìí kò dàbí tiwọn, pàápàá jùlọ ní ìtọ́jú àwọn àìsàn yìí. Ìkejì ni pé bí àìsàn yẹn bá dé nígbà tó bá ní pàjáwìrì, ìrànlọ́wọ́ ló ń tètè sí ní agbègbè yìí. Tá a bá wo ti òkè òkun lọ́hùn, so ó ń pọ̀ sí ni. Bí a ṣe ń gbé ìgbé ayé wa ó ti yàtọ̀ sí ti tẹ́lẹ̀, bí àwọn baba ńlá wa ṣe gbé ó ti yàtọ̀. So àwọn nǹkan kan báyìí nǹkan tó dẹ̀ fà á ni pé tí àwọn nǹkan yìí bá farahàn nípa bá a ṣe ń sanwó gbogbo àyẹ̀wò, owó ìtọ́jú, ọ̀pọ̀lọpọ̀ ni òun lè tọ́jú, ni òun lè wá owó láti ṣe ìtọ́jú ara ẹ̀ fún gbogbo àwọn nǹkan báyìí. So nípa ìdí èyí ó ń pọ̀ sí pàápàá jùlọ ní ilẹ̀ adúláwọ̀. Ṣùgbọ́n ìrírí wa pẹ̀lú àwọn nǹkan tí a ń rí kà fi hàn pé ní òkè òkun ó ń lọlẹ̀ nítorí àwọn máa ń tètè dá sí. Wọ́n dẹ̀ ní oríṣiríṣi nǹkan láti tètè tọ́jú ẹ̀, àti pé wọ́n rí àǹfààní wípé wọ́n ò ní láti sanwó lápò ara wọn kán tó rí ìtọ́jú gbà. So ó ń pọ̀ sí ní ilẹ̀ adúláwọ̀ nítorí pé à ń gbé ìgbé ayé ti àwọn òkè òkun, à ń jẹ oúnjẹ òkè òkun ṣùgbọ́n a ò ní ìtọ́jú.
Ẹ ṣeun gan ni dókítà. Mo máa kó tó dé pé a béèrè lọ́wọ́ yín bóyá a lè rí ìtọ́jú dáadáa níbí àti ní táwọn ìjọba gan ń ṣe láti lè rí pé a rí ìtọ́jú tó péye Very much for staying tuned. This is still Glow Health Talk with Nigerian Medical Association Ondo State Chapter. This program is co-sponsored by NMA Ondo Branch. And of course, we're talking about cardiovascular emergencies today, the causes, the preventions, and more to it. Those are the things we're looking at today. And we do have a doctor who knows the onions very well, Dr. Tunji Olaoye. He has been helping us do justice to the questions being asked. Doctor, I would like to ask you again, how common are these cardiovascular emergencies? And in your observation, are they on the increase when compared to time past? Please, I want you to explain to our listener at home.
Cardiovascular disease are the major cause of death worldwide. Is the number one.
Wow.
Earlier, before this, in the last few decades, we used to have communicable diseases like tuberculosis, malaria, pneumonia as the major drivers of death, cause of death in Africa, majorly. But now we have cardiovascular disease leading. And the unfortunate thing about it is that Africa is the major focal point for this cardiovascular disease. And the issue is because while we engage in affluent lifestyles, Western lifestyles, we do not have a corresponding facility in terms of care, in terms of support, in terms of personnel that have to manage some of these conditions. So, which make it a major issue for us. While we engage in all those things, we do not have the support facilities. So, it creates a big gap. So, if someone is even engaging in refined foods, a lot of fatty diet and things like that, if individuals develop diabetes, so we do not have people to even care. We don't have the facility to support. So these are the issues. So of course, it's a major cause of death and responsible for about 20%, about 20 million deaths globally, and the majority of it are in Africa. And of course, is the numbers, incidence is increasing. Likewise, the prevalence, they are increasing. And the major one is the fact that it's reducing in the other part of the world, in the developing nations, in the developed nations. But in sub-Saharan Africa and Africa entirely, this condition is increasing. And of course, we have talked about issues that are responsible. Why is it increasing in our own society? We have talked about the fact that we do not really have the facility, especially to detect early and also to manage the condition. And when the complications also arise, we do not have the personnel and other support system that could make it something that we can address. So it's increasing in Africa, while it's reducing in other parts of the world. But globally, it's the number one cause of death.
All right, thank you. You mentioned something. Let me quickly ask you just before we may skip it towards the end of the program. You said we do not have enough personnel. Are you saying that those who are capable of, treating these diseases, they are not in the country as we speak, or we have limited ones? I want you to be very specific because, sometimes words are weighty. So I want you to be explicit in your explanation.
Okay, well, what I mean is that the numbers of when you look at the population of Ondo State and you consider the number of doctors that are here, so and you also look about the health facilities, vis-a-vis the primary health care, they have a role, especially managing uncomplicated hypertension. Then we also move to secondary health care. How many doctors do we have? And other supporting healthcare workers. Then we move to tertiary hospital. So it's not that the people available and the experts are not available, because we have, but does the number correspond to the population? So that's the major concern.
Okay.
And for someone to someone is seeking help, you have to transfer an individual from maybe Igbokoda that is coming to Futa Teaching Hospital in Akure. I don't know how bad the road is, and I also don't know how many hours it will take such an individual. But if the primary health care, the general hospitals, Okay, if we have the personnel and all those things are there, of course you can prevent some of these cardiovascular emergencies. We can manage them at the level of uncomplicated hypertension or uncomplicated diabetes mellitus.
All right, thank you very much, Dr. Olaoye. Let me ask you, bóyá kí n dẹ̀ bèrè lédè abínibí wa, kí ni àwọn àmì tí ènìyàn lè rí ṣẹmọ̀ tó tọ́ka sí wípé ìpèníjà pàjáwìrì láti inú ọkàn fẹ́ ṣẹlẹ̀ tí kó tó di wípé ó ṣẹlẹ̀, àwọn àmì ara tó máa sànyàn téèyàn máa rí bí alára ènìyàn ni tàbí lára èèyàn tíyàn mọ̀ tí ẹ máa wò pé ó dàbí pé ìpèníjà pàjáwìrì ó ti fẹ́ ṣẹlẹ̀ sí lágbájá, ó ti fẹ́ ṣẹlẹ̀ sí tàmẹ̀dò. Kí ni àwọn nǹkan wọ̀nyí àpẹẹrẹ tíyàn lè rí, mo fẹ́ kẹ́ ṣàlàyé fún wa.
Oríṣiríṣi àpẹẹrẹ ni a dẹ̀ máa bẹ̀rẹ̀ láti bí èèyàn míì tí ó ṣeé ṣe kó ní stroke ní bóyá ọ̀sẹ̀ méjì, ọ̀sẹ̀ mẹ́ta àbí bó tiẹ̀ jẹ́ ọ̀la. Ó ṣeé ṣe kírú èèyàn bẹ́yẹn kó má rọrùn sùn dáadáa. Ó dẹ̀ lè máa ní ẹ̀fọ́rí. Irú èèyàn bẹ́ẹ̀ ó lè máa rí pé ó dàbí pé ojú ń ṣú lójijì tí ò rí bẹ́ẹ̀ kó tó di àsìkò yẹn. Ìyẹn jẹ́ ti ọpọlọ pé à ń sọ̀rọ̀ nípa ti stroke. Ẹlòmíì tí ẹ lè jí ní àárọ̀ kó rí pé òun lè gbé ọwọ́ kan, òun lè gbé ẹsẹ̀ kan dáadáa. Láàárín bí ìṣẹ́jú kan sí méjì àbí wákàtí kan kó rí pé gbogbo ẹ̀ ti padà sípò. Irú eléyìí ó lè jẹ́ pé nǹkan tó ṣẹlẹ̀ ní lọ́gán tá a máa ń pè ní transient ischemic attack. Irú ìyẹn lẹ́sẹ̀kẹsẹ̀ ní bí wákàtí kan sí mélòó kan ó lè lọ àbí ìṣẹ́jú. Tó bá jẹ́yàn tí ò ní ìfúnra, ṣùgbọ́n tó bá jẹ́yàn tó ní ìfúnra ni ó jẹ́ kó kàn sí àwọn dókítà nígbà tí eléyìí bá ṣẹlẹ̀. Nígbà tá a bá fura, tá a bá ṣàkíyèsí eléyìí, ó lè ju bí ọjọ́ méjì mẹ́ta àbí ọ̀sẹ̀ kan gan àbí oṣù kan ní stroke gangan ó wá lè ṣẹlẹ̀. Ìkejì ní ti ọkàn. Èèyàn tó bá máa ní nǹkan tí a máa ń pè ní ìdádúró ọkàn lójijì tá a máa ń pè ní cardiac arrest. Ó lè máa ní bí káyà máa ṣe pìpìpì kó máa sáré, àbí kó dàbí pé a gbé ẹrù sí èèyàn ní àyà, àbí kéèyàn tiẹ̀ máa làágùn lójijì, àbí kí àyà máa dùnyàn tó dẹ̀ jẹ́ nǹkan tó ṣẹ̀ṣẹ̀ bẹ̀rẹ̀. Ṣùgbọ́n irú nǹkan báyìí, ọ̀pọ̀lọpọ̀ àwọn èèyàn tó máa ní irú nǹkan báyìí, bóyá wọ́n ní ìfúnpá tí wọn ò bójútó, ìyẹn blood pressure, àbí wọ́n ní ṣúgà, ìyẹn diabetes tí wọn ò bójútó, àbí wọ́n jẹ́ èèyàn tó máa ń fa sìgá àbí tó máa ń mu tábà àbí ọtí. Yàtọ̀ sí èyí, ìgbà míì ó tún lè ṣẹlẹ̀ nípa lára àwọn èèyàn tí bóyá wọ́n ń lọ sílé ìwòsàn, bóyá wọ́n tiẹ̀ ní àwọn nǹkan báyìí. Ní ti ọkàn ó dàbí pé wọ́n gbé ẹrù síyàn láyà, àbí pé èèyàn ò lè àyà ń dùnyàn tó jẹ́ pé kì í ṣàyà tó ti jẹ́ pé ẹlòmíì ti lọ sí ilé ìwòsàn tó gbà márùn-ún, a sọ pé nǹkan tó ṣẹlẹ̀ lọ́wọ́lọ́wọ́ kò dẹ̀ ń ṣe àyà bíi pé ìṣẹ́jú kan àbí méjì, àmì ò máa ń tó bí ìṣẹ́jú 5 sí 10. Yàtọ̀ sí yẹn, mímí náà tún lè ṣe. Èèyàn lè máa rí pé ẹlòmíì nǹkan tó máa ń sọ ni pé àwọn lè gun àkàbà ilé wọn tẹ́lẹ̀ láì jẹ́ pé mímí nira, ṣùgbọ́n sìn wọn ò ní lè ṣe mọ́ pé táwọn bá gun àkàbà ilé wọn á ti máa mí lókè lókè. So ìyẹn náà tún lè jẹ́ nǹkan tó máa ń sọ pé nǹkan kan láìpẹ́ kó ṣẹlẹ̀. So àbí èèyàn tó máa ń rin bóyá òpó iná bíi 2 sí 3 àbí 4, ó wá di pé kò lè rin ẹyọ kan mọ́, ó máa dúró láti sinmi láàrin òpó iná 2 síra wọn. àwọn nǹkan báyìí ló máa ń sọ fún wa pé ó yẹ kí irú èèyàn báyìí kó rí dókítà, àbí kéèyàn ṣàkíyèsí pé ẹsẹ̀ ń wú lójijì. Irú àwọn nǹkan báyìí ó máa ń sọ fún wa pé ó pọ̀ lóríṣiríṣi, ṣùgbọ́n àwọn nǹkan tí a lè fẹnu bà ni pé kórí máa fọ́yàn, àbí kéèyàn má rorun sùn lójijì, káyà máa dùnyàn, àbí kó dàbí pé a gbẹ́rù sí àyà yẹn, kẹ́sẹ̀ wú, kí mímí máa nira, àbí kójú máa wò bákan bákan. So àwọn nǹkan báyìí ni àmì tá a lè ṣàkíyèsí pé bóyá èèyàn máa ní pàjáwìrì ọkàn àti iṣan ọkàn, iṣan ẹ̀jẹ̀ láìpẹ́.
ẹ ṣeun gan ni dókítà wa. Mo wá fẹ́ béèrè kó tó di pé a lọ sóde Gẹ̀ẹ́sì, ǹjẹ́ a lè rí àwọn ọmọdé tàbí ọ̀dọ́ tàbí àgbàlagbà tó lè ní irú cardiovascular emergencies wọ̀nyí? For instance, irú bá ṣe ni wọ́n ń gòkè bí àwọn tó ní staircase nílé wọn, irú àgbàlagbà tó ti pé bíi káṣà ní bíi 60 upward 70, 70 plus and all. Ṣé ẹ rò pé tó bá ń sọ pé ó rẹ̀ wọ́n bó ṣe ń gòkè lọ tó ń gòkè bọ̀, ṣé ẹ rò pé wọ́n ti fẹ́ ní cardiovascular emergency àbí àgbà ló dé tí wọ́n lè ṣe bí ìgbà tí wọ́n rìn ìgbà tó wà ní èwe? Then àwọn ọmọdé náà ṣé wọ́n lè ní irú àwọn àrùn báyìí, ìpèníjà báyìí?
Bẹ́ẹ̀ ni, ká bẹ̀rẹ̀ ní ti ọ̀dọ̀ àwọn ọmọdé. Àwọn ọmọdé lè ní, and tá a bá wo àyíká wa nísìnyí, nǹkan ti rọrùn gan. A sọ lẹ́ẹ̀kan pé àwọn nǹkan tó ń fa ìpèníjà yìí ni oúnjẹ. Tẹ́ bá rí ọ̀pọ̀lọpọ̀ oúnjẹ tá à ń jẹ nísìn, oúnjẹ kíákíá ni, tí àgbékaná níṣẹ́jú kan sí méjì ó ti ṣe tán, bá pando yam, oríṣiríṣi nǹkan tá à ń jẹ. Yàtọ̀ sí yẹn ni pé ìgbà tá à ń lọ léèwé secondary school, ká tó dé léèwé láàárọ̀, a máa ń fẹsẹ̀ rìn tó 30 ìṣẹ́jú. Ṣùgbọ́n sìn láti bí ọmọ ọdún méjì sí ọkọ̀ la fi ń gbé gbogbo wọn dé léèwé. So yàtọ̀ sí yẹn, àwọn ọ̀dọ́ tún rí àyè láti máa mu ọtí wà. Oríṣiríṣi nǹkan báyìí ló ti wà ní àyíká wa. Oríṣiríṣi tábà làwọn èèyàn ń mu sí, Canadian loud, oríṣiríṣi ọ̀nà làwọn èèyàn fi ń mu egbò olóró tó dẹ̀ ń dá ìjàmbá bá ọkàn. A máa rí àwọn ọ̀dọ́ bó tiẹ̀ jẹ́ pé wọn ò pọ̀ tó àwọn àgbàlagbà, ṣùgbọ́n a máa ń rí wọn. A máa ń rí bí ọmọ 30 ọdún, bí ọmọ 40 ọdún. Eléyìí tó tiẹ̀ yà wá lẹ́nu jù ni pé tá a bá fi àwọ̀ wò ó ní ọ̀dọ̀ wa ní ilẹ̀ adúláwọ̀ pẹ̀lú àwọn oríṣiríṣi research tá a ti ṣe, àwọn ọ̀dọ́ ní ìpèníjà yìí ló máa ń bá fíra ju àwọn àgbàlagbà lọ ní ọ̀dọ̀ tiwa. Àwa tá a tiẹ̀ ń ṣe tá a jẹ́ bí dókítà ní ti ààtì yìí, a máa ń fi ọ̀pọ̀lọpọ̀ ìrànlọ́wọ́ tó kọjá ti eléyìí tá a máa ń fún àwọn àgbàlagbà tó bá ti jẹ́ ọ̀dọ́. Ìdí dẹ̀ ni wípé a rí pé wọ́n ń fẹ́ràn láti máa lo oògùn déédé bí àwọn àgbàlagbà. Èkejì ni pé wọ́n dẹ̀ máa ríran lọ́wọ́ nípa ti owó. Ẹ mọ̀ pé ìgbà míì àgbàlagbà míì lè máa tọ́jú tó pé ọmọ ló máa ń ná gbogbo owó yẹn, ṣùgbọ́n àwọn ọ̀dọ́ wọn ò rí ríran lọ́wọ́ báyìí. So eléyìí ló jẹ́ kí ó máa ń lágbára, ó dẹ̀ máa ń pọ̀ lọ́dọ̀ àwọn ọ̀dọ́ ní Áfíríkà. A máa ń sọ pé àìsàn ọkàn àti iṣan ọkàn ní ilẹ̀ adúláwọ̀ a máa ń rí ní bí 40 ọdún sí 50 ọdún. Tá bá dẹ̀ wo àwọn aláwọ̀ funfun, a rí pé a máa ń rí ní bí ọgọ́ta ọdún dé àádọ́rin ọdún. tó nígbà tí àwọn èèyàn wa ọjọ́ orí tó bá jẹ́ pé ó yẹ káwọn náà kọ́ máa ṣe contribute to the society, contribute to their family, ni àwọn kan báyìí ló máa ń gé ẹ̀mí wọn kúrò. ìyẹn bẹ́ẹ̀ àwọn àgbàlagbà tó bá jẹ́ pé oríṣiríṣi nǹkan ló lè fà á. ìgbà míì ó lè jẹ́ bóyá nǹkan táwọn àgbàlagbà máa ń pè ní àgìdì, bóyá arthritis, ó lè jẹ́ kó má lè rìn dáadáa láti gun àkàbà ilé. ṣùgbọ́n a sọ lẹ́ẹ̀kan pé àwọn kan báyìí lójijì ló máa ń ṣẹlẹ̀. èèyàn tó ti bó tiẹ̀ jẹ́ àgbàlagbà ni a rí i pé àwọn máa gun step yìí tẹ́lẹ̀, and bóyá láàrin bí ọ̀sẹ̀ kan àbí àárín ọ̀sẹ̀ méjì ó wá rí i pé ó wá ń nira. nǹkan báyìí ó máa ń ṣẹlẹ̀ láàrin péréje tí ò ń pẹ́.
ẹ ṣeun gan ni dókítà wa ẹ kó atótónu láti ẹ̀kan. mo rí i pé ẹ ṣàlàyé fún alẹ́ kan rẹ́rẹ́. ẹ jẹ́ sáré béèrè lọ́wọ́ nílẹ̀ Gẹ̀ẹ́sì kó tó di pa tó dátàn mi náà. a ó ṣe ojú òpó lẹ̀ láìpẹ́. tó bá ti di àkókò yẹn a máa pa àwọn nọ́mbà sí. tó jẹ́ bá ti yọ̀ǹda nọ́mbà báyìí àwọn ò ní jẹ́ ká gbọ́ ẹ̀kọ́ mọ́ lọ́wọ́ yín. Doctor, I would like to ask you, what warning symptoms and signs, you've said this in our mother tongue, what warning symptoms and signs, would an individual at risk of cardiovascular emergency experience or notice, before it progresses to the emergency state? The early warning signs, you've mentioned them in our mother tongue. I want you to please reiterate this in English for the benefit of those who are listening at this time.
The warning signs depends on the part of the body that this cardiovascular emergency is about to affect, or that is the major potential risk. We start with the brain, where we can have a stroke. That individual may have poor sleep before that time. Then there could also be headache that is not responding to anti-malaria treatment or paracetamol or common common medications that we use for headaches. Then an individual can start feeling dizzy. Then there could be blurring of vision. Some could even go as far as not able to lift one part of the body, or they could have slow speech, not able to, people will not hear them clearly. Especially those can happen in a condition where we call transient ischemic attack. And this could resolve within hours. And for that individual, he may miss the opportunity to see a health personnel. And if this condition now comes next, it may be more severe and it may now become permanent. So this can be the symptoms or warning sign in stroke. Now, the heart, where an individual can develop a heart attack or heart failure. For heart attack, individual could feel chest pain if taking a walk that resolve by resting. At that stage, we call it angina or stable angina. So maybe an individual can take a walk of about 5 to 10 minutes without getting any form of chest pain. But now, after like 5 minutes walk, there's chest pain. And immediately that individual take a rest, he feel relief. Those are warning signs. Then,
at what age, this sign that you have just mentioned, at what age? Because like I would always ask you, we have the elderly too, and the adults. For instance, people in their 30s, 40s, and working that 10 minutes and getting tired or having pain in their chest is understandable. How about the elderly, about like 60, 70 years old upward, having to work for that same duration, 5 to 10 minutes, and they have, is this same thing, or one is age and one is not okay, or one is okay? I want you to explain. Well, I don't want us to miss any part of your explanation.
irrespective of the age, we have what we call classic presentation.
Okay.
And that classic presentation is when an individual, after a bit of exercise, feels chest pain, whether it's young or old. Now, we now have a typical presentation in some certain group of people, especially elderly females. All the feelings may just be as if they are having ulcer. Okay, and there could be some difficulty in breathing. So those categories of people, we say that they have atypical presentation. But typically, whether they are young, whether they are old, angina is exceptional chest pain. Now, that is about the heart attack. Of course, we also have heart failure. An individual could also have difficulty with breathing, then poor exercise tolerance, then easy fatigability, getting tired by just a small activities. Okay, then there could be leg swelling. When individuals suddenly develop any of this, don't forget we mentioned earlier that this chest pain is not the chest pain that an individual has been talking about in the last 4, 5, 6 weeks that goes with use of maybe paracetamol and all those. They are very typical. But irrespective of the form of chest pain, we should always seek help immediately at the nearby hospital, at least to be sure which form. An individual could also have palpitation, especially palpitation could also be evaluated, especially in those that have the risk factors. We've mentioned the risk factors, we've mentioned the etiology, hypertension, diabetes, obesity. These are major things. So if individual have all these things and is having palpitation, is having all those things that we have mentioned, there is need for further evaluation. Of course, for those that do not have all this, or they have yet to identify it or know that they have it, it's also good that they also seek medical help.
Thank you very much, Dr. Tunji Olaoye. Let me ask you this before we open the phone lines in our mother tongue. Dókítà, ǹjẹ́ ìtọ́jú wà tí a lè ṣe ní abẹ́ ilé fún ẹni tó bá ní ìpèníjà pàjáwìrì tàbí tí àmì bá ń sọ wọ́n ní ara tó lè fi hàn wípé ó ṣeéṣe kí irú ẹni bẹ́ẹ̀ ní ìpèníjà pàjáwìrì tí ó ní ṣe pẹ̀lú ọkàn ẹni náà tàbí ẹlòmíràn tàbí ẹni tó bá wà láyìíká àti agbègbè wa?
Kò sí ìtọ́jú pàjáwìrì ọkàn àbí iṣan tó ń gbé ẹ̀jẹ̀ nílé rárá. Àwọn nǹkan tá a sábà máa ń ṣàkíyèsí ní àwọn ilé ìwòsàn wa ni pé àwọn èèyàn wa máa ń wá nígbà tí ó bá ti pẹ́ jù. Nǹkan tó dẹ̀ máa ń fà ni pé tí nǹkan báyìí bá ti ṣẹlẹ̀, ìgbà míì àwọn nǹkan tá a máa ń ṣe ní wákàtí kan, wákàtí méjì tí ọ̀rọ̀ yìí bá ṣẹlẹ̀, ó máa ń nípa bóyá ẹnìyẹn ó máa yè àìsàn yẹn àbí kò ní yè. Ìgbà míì ẹlòmíì ò tiẹ̀ ní mọ́ra mọ́, àwọn èèyàn wá sì máa fún lépo láti mu. Irú eléyìí tí ò bá dẹ̀ lọ síbi tó ń jẹ́ ń lọ, ó ń lọ síbi tí afẹ́fẹ́ máa ń lọ. Tó bá dẹ̀ lọ síbi tí afẹ́fẹ́ tí a máa ń pè ní lungs, ó ti fa wàhálà. Yàtọ̀ sí pé ẹnìyẹn ní stroke, ó tún ti ní nǹkan tó ní ṣe pẹ̀lú ibi tó fi ń mí. Ìkejì ni wípé ìgbà míì gbogbo nǹkan lọ́dọ̀ àwọn èèyàn wa, bóyá èèyàn ń convulse nílé tó ní stroke, wọ́n lè fẹ́ fi ó ń ṣe gìrì, wọ́n máa fi nǹkan tá a máa ń pè ní ṣíbí sí lẹ́nu. Then gbogbo ìṣẹ́jú kan, ìṣẹ́jú méjì, àwọn wákàtí tá a fi ń ṣòfò yìí, ọpọlọ ló ń lọ, ọkàn dẹ̀ ló ń lọ. Ibi tí ọpọlọ ibi tó bá dẹ̀ ti pọ̀, tó bá ti lọ sí, bẹ́ẹ̀ náà ni oore ọ̀fẹ́ láti yè àìsàn yẹn ló ń lọlẹ̀ sí. We call it time is brain and also time is heart. So tá a bá ṣe ń fi àkókò ṣòfò nípa pé à ń ṣe ìyànjú ńlé, òun ni ọ̀fẹ́ fún èèyàn bẹ́ẹ̀ láti yẹ àìsàn yìí ló ń lọlẹ̀. Àwọn nǹkan tá a lè ṣe kò ju pé bóyá a fi ẹnìyẹn sí position, a máa ń sọ pé kán fi ẹ̀gbẹ́ òsì kẹ́nìyẹn fi sùn kátẹ́gùn lè máa wọlé dáadáa, àbí ká yọ àwọn aṣọ ẹlòmíì irú kan báyìí lè ṣẹlẹ̀ bóyá aṣọ tó wọ̀ kó tó ṣẹlẹ̀ ó lè jẹ́ aṣọ tó fúnyàn, so kán yọ irú aṣọ bẹ́ẹ̀ ká dẹ̀ fi ẹnìyẹn síbi tí atẹ́gùn tó lè wọ̀ ọ́ lára. Ju àwọn nǹkan kéékèèké báyìí kò sí nǹkan míì. Tá bá dẹ̀ wá ṣẹlẹ̀ tá bá rí èèyàn tó yá pé ọkàn dúró lójijì ńlé tá máa ń pè ní cardiac arrest, tá bá rí àwọn tó lè ṣe CPR pípa títẹ àyà nítòsí, wọ́n lè bẹ̀rẹ̀ kán dẹ̀ gbé ẹnìyẹn wá sí ilé ìwòsàn. Nípa ti ìpàjáwìrì ọkàn àbí ti iṣan tó gbé ẹ̀jẹ̀ kúrò, díẹ̀ la lè ṣe ńlé nípa ìtọ́jú ẹ̀. Ẹ ṣé Rótù.
Ẹ ṣeun gan-an dókítà, gbogbo ẹ̀ lẹ ṣe lálàyé lẹ́kùnrẹ́rẹ́. Mo lérò pé àwọn ará lè ti kàn nǹkan tàbí méjì tàbí mẹ́wàá gan lórí tẹ́ ẹ ti ń mẹ́nubà láti àárọ̀. A máa ṣojú òpó lẹ́bàá numbers tẹ́ lè pè wá sí náà ní 0805 551 1110 0805 551 1110 tàbí 0706 677 1822. Máa pè lẹ́ẹ̀kan sí 0706 677 1822 tàbí tálá kankan yẹn 0805 551 1110. Òun ni nọ́mbà tó wọlé tààrà sí nínú yàrá agbára ń bì. Dókítà tí ń bá wa yànnàná gbogbo ohun tá a lè mọ̀ nípa cardiovascular emergencies láti àárọ̀. Dókítà, mo fẹ́ béèrè ìbéèrè àmọ́ ẹ jẹ́ n béèrè lédè Gẹ̀ẹ́sì àti ń béèrè lédè abínibí wa látẹ̀kan. Doctor, I want to ask you, are facilities for managing cardiovascular emergencies, interventional cardiological facility, readily available and accessible to our people in the state and in Nigeria? And how affordable is it? Because I'm sure many persons would want to ask these questions.
Depends on when we talked about stroke, of course we have the facilities, we have the personnel, especially at the tertiary healthcare level. That can be managed, especially if an individual presents earlier. This does not still exclude the fact that there could be some logistic delays in terms of investigations. So if an individual has stroke, we need CT, brain CT, and of course we really appreciate those that are investing in the healthcare sector in terms of private participation. We have few centers within Akure metropolis that we can do brain CT. And of course our facility at FMC Owo, we also have a brain CT. This could also help. So if we make the diagnosis of stroke, we can quickly manage it in our environment, and we have the facilities, we have the personnel, like I said, at the tertiary healthcare. That's one I can speak of. Now, but if it comes to the heart, like cardiac emergency, an individual has maybe myocardial infarction, which we call a heart attack. For now, the closest place to us is Afe Babalola, which is Abuad in Ado-Ekiti. We have very few facility. We have about the total cath lab. We call it cath lab. That's where we do major intervention for cardiac emergency. The entire Nigeria, that's for a population of about 200 million people. We have 30 in the whole of the country. And these ones are majorly concentrated in Lagos and also Abuja. So those are the two main places we have. So except for the one in Afe, where some of our patients in the past, especially in Ondo State, have benefited from. So is it available? Of course, but for someone that has a heart attack, transporting such individual to Lagos, that's an house. So then in addition, is it affordable? That's the major issue. Even when we identify these conditions and when we have noted that, oh, you need this intervention, the average cost for any cardiac treatment of any form of MI or myocardial infarction, so say, is minimum is about 5 million to average of about 15 million naira. So, and we also, all of us are aware that most of these things are from families, individual pockets, and because even the insurance that we are still using in the country, basically at secondary healthcare level, and most people are just at the primary healthcare level. So, it's not readily affordable, okay, and we only have few facilities that could offer such in the country, with most of them concentrated in urban centers like Lagos and Abuja, where we have people that can afford this treatment.
All right, thank you very much. Doctor, you did say something. You said it can be managed. I want to ask, can it be cured? Let's even ask that. Can it be cured? I want you to answer in simple terms. Can it be cured if presented early? Maybe I didn't get you right, or we didn't get you right. You said if they present the case early, it could be managed. Can it be cured when it is presented early, when the emergency has not degenerated to other things? Or it has not got into the emergency state? Can it be cured?
Is the risk factors now? We talked about the risk factors. That can it be cured? I think the major thing is that most of the major risk factors for this disease are modifiable. What we mean by modifiable risk factor is that there are things that we can address individually. There are some people that the major issues is lifestyle. There are some that the major issue is obesity, and if they address the lifestyle, of course, there are individuals that could come up with high blood pressure of maybe around 150/90, and you counsel such individual. They do a bit of exercise, they improve on their lifestyle, and you discover that the thing becomes regularized and becomes normal while you continue to monitor. But there are also some that because age, despite all these things that we have mentioned, age is the most important risk factor for all these things. So as one continues to age, the risk of having some of these conditions continues to increase. So it's not the fact that we can cure it. In as well, it's not easy for an individual to become younger. So some of these conditions cannot be cured, but can be managed. But for those that are majorly driven by lifestyle, if the lifestyle is well addressed, of course, the risk factors can be eliminated, and that could solve the problem.
Ẹ ṣeun gan ni dókítà. Mo fẹ́ bèrè ní méjì ní tìbejì. Ṣé ìtọ́jú wà fún àwọn tí ó ní ìpèníjà pàjáwìrì ti ọkàn àti ọ̀pá ẹ̀jẹ̀ ní agbègbè wa? Ìyẹn ìkíní. Mo dẹ̀ ti fẹ́ bèrè pé ìmọ̀ràn wo lẹ ní fún àwọn aráalé lórí ọ̀rọ̀ tá à ń sọ pẹ̀lú ọkàn, ọ̀rọ̀ tó ní ṣe pẹ̀lú ọkàn, ọ̀rọ̀ tó ní ṣe pẹ̀lú àwọn ọ̀pá ẹ̀jẹ̀ wọ̀nyí, torí àkókò ti kó wa ní pápámọ́ra.
Ẹ ṣé. Fún àwọn ará ilé, ìtọ́jú wà, ṣùgbọ́n ibi tí ìtọ́jú yìí wà ó jìn díẹ̀, pàápàá jùlọ ilé tó ní ṣe pẹ̀lú ọkàn. Nǹkan tá a lè rọ àwọn èèyàn wa ni pé nígbà tí ọ̀rọ̀ yìí ò bá tí ì dá ti pàjáwìrì, ká bójútó. And àwọn kan tá a lè ṣe láti fi bójútó ní àkọ́kọ́, ká rí i pé à ń jẹ àwọn oúnjẹ tí ó máa ṣe ara lóore láì ní dá wàhálà sílẹ̀. A ti sọ oúnjẹ bíi eléso, bí ẹ̀fọ́, àwọn nǹkan báyìí máa ń ràn wá lọ́wọ́. Ká dẹ̀ fi ká gé bá ṣe ń jẹ àwọn bí ẹran oríṣiríṣi, ká gé kù nípa nǹkan tá à ń ṣe. Then ó dẹ̀ jẹ́ ká ti gbà wá nímọ̀ràn náà, ká máa gbìyànjú láti máa rìn àbí ká máa ṣe exercise léyìí tó máa jẹ́ kí ìlera wa kó dájú dáadáa. Then àwọn tí ó bá ní ìfúnpá, ká bójútó. kì í ṣe pé a ti lọ sí ilé ìwòsàn àti gbà yẹn oògùn tá ti ń lò àwa rí dókítà kó wò ó jù bẹ́ẹ̀ lọ. A ní láti máa lọ sí ilé ìwòsàn kán wò wá lóòrèkóòrè. Ìtọ̀ ṣúgà náà ká bójútó. Àwọn tó bá dẹ̀ tán sanra kán gbìyànjú láti bójútó. Tó bá dẹ̀ jẹ́ pé ọ̀rá ni tá máa ń pè ní dyslipidemia kí àbójútó. Gbogbo àwọn nǹkan yìí tá bá dẹ̀ tún ní ìbéèrè a lè rí ilé ìwòsàn tó bá wà nítòsí, wọ́n tún máa gbà wá níyànjú àti oríṣiríṣi nǹkan la dẹ̀ tún lè rí ní orí kọ̀ǹpútà àti íńtánẹ́ẹ̀tì láti tún ràn wá lọ́wọ́ síwájú sí.
ẹ ṣeun gan ni dókítà wa a ò ní rí ju báyìí lọ. Àwọn náà ni ẹni tó ti ń bá wa sọ̀rọ̀ láti ẹ̀kan àlejò wa, wọ́n ní consultant cardiologist Federal Medical Center Ọ̀wọ̀, dókítà Tunji Olaoye. Ẹ ṣeun pé àpò yín sórí ètò ẹ̀dẹ̀ wa lónìí.
Ẹ ṣé olóòtú.
Ọ̀sẹ̀ tó ń bọ̀ ló tún dá lágbára Elédùà. Ọpẹ́ pàtàkì lọ́wọ́ producer ètò yìí yẹn dókítà Ọpẹ́yẹmí Kọ́mọláfẹ́. Wọ́n wà ń kalẹ̀ pẹ̀lú wa ní gbogbo ìgbà. Ẹ máa rántí pé ètò yìí jẹ́ ìsowọ́pọ̀ pẹ̀lú Glo 99.1 FM àti Nigerian Medical Association yẹn ti ìpínlẹ̀ Ondo ń bí. Lórúkọ executive producer wa dókítà Ezekiel Akande. Orúkọ tèmi ní Comfort Ọmọláfẹ́. Ẹ máa rántí wípé ìlera lọ́rọ̀.